Asepsis includes all measures taken to prevent infection or to break the chain of infection. And as you'll see as you watch the skills demonstrated in this module, proper use of these techniques is crucial to positive outcomes. There are two types of asepsis. Medical asepsis aims to reduce the number and transfer of pathogens. Surgical asepsis, or sterile technique, renders and keeps areas and objects free of microorganisms. Proper hand hygiene is the most effective way to prevent the spread of organisms. To be effective, nurses must perform hand hygiene correctly and at the right times. Some conditions require sterile technique. Nurses must know how and when to properly put on sterile gloves and remove soiled ones. Preparing a sterile field properly, whether from a pre-packaged kit or from individually packaged supplies, is a skill that can also help break the chain of infection. And the proper use of personal protective equipment, PPE, things like goggles, gowns, and face shields, help protect both patients and healthcare providers. Using all of these skills properly every day is the key to preventing the spread of infection and ensuring a successful plan of care for each patient.
All right, Tamika, hands. Yeah. When should they be washed?
According to the CDC, hand washing is required, using soap and water, of course, before eating, after using the restroom, and if hands become soiled with blood or bodily fluid or visibly dirty.
Good. Now, Paula, what's the right way to start washing your hands before you even turn on the water?
Well, definitely make sure you've removed any jewelry and always keep your clothes away from the sink.
Good, and why is that?
Well, to prevent contamination of your clothes. And also jewelry can harbor microorganisms and contaminants.
Exactly. Robert, why don't you go ahead and turn on the water and be careful about the force of the stream so you don't splash your clothes.
Okay.
What's the proper water temperature?
Well, the water should be warm to the touch.
That's right. Okay, you're going to want to wash your hands, keeping your fingertips below your elbows because you want the water to run down towards your fingertips, all right? Now we have a soap dispenser here, but you may find yourself in a situation where there's a bar of soap. So what's the difference?
Well, with a bar of soap, you want to wash the soap before using it, and then wash it before returning it to the soap stand.
Good. It's important to get good friction going to loosen the dirt that can get into the skin crevices. Make sure you wash up to an inch above any visible dirt or an inch above the wrists. Take care to wash your palms, back of the hands, fingers, and the areas between the wrists, knuckles, and forearms.
Like this? I should use a firm circular motion, right?
Yes. Now use your fingernails of the opposite hand to clean under the other fingernails. How long should you wash your hands?
At least 15 seconds.
Yes, at least 15 seconds. Okay, Robert, you're going to want to rinse your hands thoroughly now. Keep your hands below the level of your elbows to avoid contaminating forearms or elbows. And once you're done, you're going to want to leave the water running while you get a paper towel or two. And why is that?
Well, you always have to consider that the sink itself is contaminated.
Exactly. So take the paper towels and begin to dry your hands, starting at the fingertips and working your way up the forearms. Then you're going to want to use another paper towel to actually turn off the sink.
Miss Swenson, is it all right if I use moisturizer? In the winter, my hands get really chapped.
Moisturizing lotions are fine as long as they're oil-free.
Well, if a sink isn't available, could you use one of those alcohol-based antiseptic solutions?
If your hands are not visibly soiled or contaminated with body fluid, then you do have the option of using an antiseptic hand rub. Can anyone tell us what we should keep in mind when using these solutions?
Yeah, there are different decontamination requirements at each institution, and we should be aware of the product label and instructions for the antiseptic hand rub.
Right. Okay, Tamika, how do we go about applying antiseptic hand rub?
Okay.
All yours.
First, I apply the recommended amount of product into the palm of my hand, then rub the lotion into my hands with a circular motion, making sure to get into the same crevices that I would when washing my hands. I continue rubbing until the product is evaporated on my hands.
Excellent. Okay, Now, several of your patients today have treatments that require using sterile technique. So let's review some of those skills.
Will we be setting up a sterile field?
Yes, and we'll also review how to put on sterile gloves and personal protective equipment. So first, let's review the guidelines related to sterile technique and sterile gloving. What can come in contact with sterilized items? Robert?
Well, only sterilized items can come in contact with other sterilized items, like sterile gloved hands.
Speaking of gloved hands, when would you replace your sterile gloves, Paula?
Well, if your gloves develop an opening or a tear, or if there's a compromise in the integrity of the material.
When else?
If your hands touch any unsterile surfaces or other items.
And?
Oh, right. If your hands go below your waist, that's also considered contaminated.
Good. What's the easiest way to compromise a sterile field?
And by turning your back on it or not keeping it above waist level.
Exactly. And remember, never reach over a sterile field. Robert, tell me a little bit about your patient.
Well, I'm going to be taking care of a patient who has a surgical incision that is separated and opened. Her physician has ordered dressing changes twice a day.
All right, well, why don't you gather your supplies, greet the patient, take off the old dressing, and I'll meet you in there in a few minutes.
Sounds good.
All right.
See you later. You ready, Mrs. Watson?
Yes.
Okay, good.
Come in.
Good afternoon, Miss Watson. I'm Danielle Swenson, Robert's nursing instructor. Is it okay with you if I observe while he cares for you?
Well, that's just fine.
All right,
you.
thank you. So, Robert, how are you doing?
Well, I've just removed her old dressing, and I'm ready to start preparing for the sterile field.
All right, so before opening anything, what should be your first order of business?
Well, I cleaned my hands, and I made sure the table is waist level and within reach. And I've already checked her ID band and removed her old dressing. So now I should just check the packages to make sure that it's intact and not expired.
Everything check out?
Yep.
So what's next?
Set up the field with the drape.
And how is that done, Robert?
First, I have to open this package. Then I lift the drape by the corners, but an inch away from the edges, and gently shake it open fully.
Be sure to keep it away from your body and any other surface. And which side do you put down, Robert?
The moisture-resistant side down. This would be the shiny side or sometimes a blue side. Then I lay the drape on the work surface.
Good. Now, how would you put other items on the sterile field?
Nothing unsterile can touch the sterile portion of the drape, including hands or clothes. If I'm going to add a commercially packaged item, like the gauze sponges here, I hold the package in one hand and pull back on the top cover or peel the edges apart, like so. And the items need to be dropped onto the field from 6 inches, right?
That's right. And just make sure you don't touch the field with your hands. Now, Robert, what about items sterilized by the facility?
Well, you hold the package in your dominant hand with the top flap opening away from the body. So, with the other hand, unfold the top flap and both sides, holding on to the item through the wrapper with my dominant hand. Then I open the remaining flap of the wrapper closest to my body. Next, pull the corners of the wrapper back towards my wrist so the wrapper covers my hand and wrist. Then drop the item from 6 inches above the surface.
I'm very impressed. This is complicated.
Oh, you have no idea. We haven't even gotten to you yet. I still have to put gloves on.
Well, that's not all that complicated.
Oh, you'd be surprised. Robert, why don't you show us the proper technique for putting on sterile gloves?
Sure. So I open up the wrapper and I place the inner package on a clean work surface with the side cuff end closest to me. I open the package by first folding open the top fold, then the bottom, and the sides.
Make sure your hand doesn't come into contact with the contents inside, okay?
Okay.
Very good.
Now, with my thumb and forefinger of my non-dominant hand, I grasp the cuff of the sterile glove for my dominant hand and only touching the inside of the glove.
Now be sure your hands remain above the waistline.
Okay, so I place my dominant hand in the glove and pull it on. leaving the cuff folded until the opposite hand is gloved.
Okay, I was wrong. This is complicated.
That was just the first hand.
Okay, let's stay focused. Go ahead, Robert.
Sorry. Okay, now I hold the thumb of my gloved hand outward and place the fingers of my gloved hand inside the cuff of the remaining glove and lift it from the wrapper. I pull the glove on, making sure my skin doesn't touch any of the outside surfaces of the glove.
Now that they're both on, slide the fingers of one hand under the cuff of the other and fully extend the cuff down the arm, touching only the sterile outside of the glove.
Then I repeat for the other hand.
You can adjust your gloves as needed. And I know I've said it a million times. Remember to only touch the sterile or the outer surface of the glove, and be sure not to touch your forearm, your watch, or your garments. Okay, Mrs. Watson, let's replace those bandages.
After all that, I'm afraid of getting the gloves dirty.
Don't worry, we have plenty. All these precautions and regulations are just in place to keep you as safe from infection as possible.
I appreciate that.
All right, let's get started, Robert.
Okay.
As you know, nurses play a key role in reducing the spread of disease, and you should be prepared to deal with unexpected situations as they present themselves. For instance, Robert, let's say you are preparing to perform a sterile dressing change alone in a patient's room. Your sterile glove becomes contaminated when it comes in contact with an unsterile surface. Now your patient is prepped, draped, your supplies are already set up and ready. What do you do then?
Well, the supplies are laid out and the patient is prepped. If you leave the room to obtain a new pair of gloves, the entire sterile field is compromised and must be redone.
Exactly.
You could use the call button to summon a coworker from the nurse's station to bring you an additional pair of gloves. That would maintain the integrity of the entire sterile field.
Can I help you?
Hey, this is Robert down in room 312. Could you bring a pair of sterile gloves size 8 down here, please?
Or you could save yourself a step, extra work, and waste of time by bringing an extra pair of sterile gloves in with you. That is, if your facility policy allows for that.
Well done, Paula. By thinking ahead a little bit and planning for the possible complication, you're able to better manage your time and prevent inconveniencing the patient, right? Nice job, Robert. You doing okay, Miss Watson?
Yes, thank you.
So now that we've completed the procedure, what's the proper method for removing the gloves?
Easy. Using my dominant hand to grasp the opposite glove near the cuff and on the outside exposed area, I pull the non-dominant glove inside out.
Be sure to invert the glove as it's removed from your hand, Robert.
Okay. Now I hold the removed glove in my hand that is still gloved, and I slide my fingers of my ungloved hand between the remaining glove and my skin.
Make sure not to touch the outside surface of the glove.
I pull off the glove, making sure to invert it, so I secure the first glove inside it. Now I discard these in the appropriate container and clean my hands.
Well done. Thank you for your patience, Mrs. Watson.
No, thank you. And I have a whole new respect for gloves now.
Have a great day. We'll check in on you later.
So, tell me about your patient, Mabel.
My patient is a man who came in with an abscess after having his gallbladder removed. He's been receiving his antibiotics and other therapies through a multi-lumen tunnel catheter. The dressing at the catheter site is due to be changed. Do you have time to help me with that?
Certainly. Now, you know there are commercially prepared kits.
Got one right here.
Oh, what can you tell me about it?
Like you said, it's pre-packaged. The kit and tray come in a sterile wrapper. Once you open it up, that wrapper becomes your sterile field.
Very handy. Any questions or concerns?
Well, I haven't worked with them that much, so I'm sure I'll need some guidance.
That's what I'm here for.
Mr. Jamal, hi. Remember me? I'm Mabel. And this is Miss Johnson, my nursing instructor.
Hello.
We're going to be changing the dressing on your IV site today, okay?
Gotta do what you gotta do, right?
Thank you. Okay. Oh, thank you so much. Here. Okay. So can I double check your ID band? Thank you. And your full name is?
Robert Francis Muhammad Jamal, but my friends call me Butch. You asked.
And your date of birth, please.
5/12/55.
Thank you so much. Okay, I'm just gonna raise the bed up. go. Okay.
Okay, so talk me through what you're doing, Mabel.
Well, I'm making sure that the package kit is unopened and it looks dry. And it is. Looks good.
And the expiration date?
Right, I need to make sure that the date is still valid. Yeah, it is.
Okay. Now you need to find a work area that's waist level or higher.
Right.
Here, use this table.
Oh, I'll get it. Thanks, Mr. Jamal. Okay. Let me lower this down. And I should. Okay.
So remember, we want to work efficiently. Do you have access to the site before you start opening your supplies?
Can I reposition your gown to see your IV site?
Sure.
I want to get everything ready so once I have the kit opened, I can get started. Okay, I'm ready, right? So now I'm opening up the package, the outside cover. And I put the kit on the table.
Make sure the topmost flap is positioned close to you.
Got it. Now I'm going to grab the flap.
Right. Grasp the outer surface of the topmost flap, holding no more than an inch from the border of the flap.
Got it. Now I'm going to pull it away, right?
Yes. Remember, pull it away from your body and keep your arm outstretched and away from the inside of the wrapper.
Because it's a sterile field, right. Here goes.
Good. And just let the wrapper lie flat on your work surface. Now what?
I do the same basic thing again, except this time I grasp the outer surface of the first side flap, no more than an inch from the border, and pull open the package. I keep my arm outstretched away from the inside of the sterile wrapper and just let it lie on the work surface nice and flat.
Very good. Now you do the same thing with the other side.
Okay, I reach around, grasp, hold about an inch from the border, pull, keep my arm straight, and let the wrapper lie flat.
You're in the groove now.
I think so, Mr. Jamal.
Now what do you do, Mabel?
Step back from the work area, take a hold of the last flap, no more than an inch from the border. I pull the flap toward my body. I keep my arm outstretched and away from the wrapper like so.
Now, keep that hand in place and use your free hand to grasp the wrapper on the underside.
The side touching the table.
Right, and position the wrapper so that when it's flat, the edges are on the work surface.
Got it.
Make sure the edges don't hang down over the sides of the work surface and make sure it lies flat.
Okay, how's that?
Good. So now the outer wrapper of the package has become a sterile field with the package supplies in the center. Just remember not to touch the sterile field. If you or anyone else were to touch the sterile field, it would be considered contaminated. You'd have to start over with another kit.
Got it. Okay, we're ready, Mr. Jamal.
Glad you are. I'd have to go to school just to learn to open one of those things.
Okay, so let's get our masks on and remove the old dressing.
Yeah, I drove over here. Oh, yeah. Use my car.
Okay, so I'd like to cover something that's very important in breaking the chain of infection, PPE. Now, we all know what that is, right?
Personal protective equipment.
Right, and when we refer to PPE, we're talking about specialized clothing or equipment worn by healthcare providers for protection against infectious agents. Why is PPE so important?
It helps keep us safe in the healthcare environment.
And prevent the transmission of pathogens. There are a variety of options when it comes to PPE, starting with gloves. When are they necessary?
Whenever you might come into contact with blood, body fluids, excretions or secretions, mucous membranes, non-intact skin, or contaminated items.
Very good. Other equipment can include impervious gowns and aprons, surgical and high-efficiency particulate air masks, plus N95 disposable masks, face shields, and protective eyewear and goggles. So, when would you need those?
Whenever there's a situation where you may come in contact with or be splashed by contaminated materials or body fluids.
And just like with gloves, you have to make sure you not only put them on right, but take them off safely too, to avoid contamination and exposure.
Exactly. You need to anticipate exposure and choose the right equipment to minimize that exposure. Understanding the potential contamination hazards related to the patient's diagnosis helps with that. And it's very important that you are familiar with institutional policies governing PPE. So, how do you choose what PPE to use?
It depends on the type of exposure you anticipate and the category of precautions that are in place.
Very good. And what are the categories of precautions?
Standard precautions and transmission-based precautions.
Right. And transmission-based precautions include contact, droplet, and airborne precautions. So, whose responsibility is it to ensure proper PPE?
Ours.
Absolutely. It's the nurse's responsibility to enforce the proper wearing of PPE during patient care for members of the healthcare team. You have to make sure everybody follows proper PPE protocol to protect yourself and your patient. Deborah has to wear complete PPE to care for her assigned patient later today. Why don't you practice putting everything on, okay?
Okay.
So why will you be needing complete PPE?
Well, my patient has a wound that we're going to be irrigating, so there's a high likelihood of body fluid or wound material splashing.
So to begin, what do we do?
Clean our hands.
Right. Perform hand hygiene.
And then put on the gown.
This is an impervious gown, and it's important that you put it on with the opening in the back. Don't forget to tie the gown securely around the neck and the waist.
I've got your back.
Thank you.
If you are using a mask or a respirator, you would put it on next and then put on your goggles to protect your eyes. Deborah's going to use a face shield today instead. It replaces the mask and goggles. Put it on right over your nose, mouth, and chin. Make sure it's snug. Pull the bottom down nice and low to give you better coverage. This reduces exposure to splashing. Then secure the ties or elastic bands at the back of the head and the neck, okay? Good.
Does Deborah need headgear or shoe covers?
Sometimes it's appropriate to have protection over the entire body, but in this case, no. Next, we put on a pair of gloves. Make sure you extend the gloves to cover the cuffs of the gown.
So, no exposed areas, even sleeves?
Right. Okay, finally, you need to check for any exposed areas on the front of your body.
Looks covered to me.
Me too. This was good practice. So when you're in your patient's room and you have put on all your PPE, what would you do next?
Confirm the patient's identity, explain the procedure to the patient,
and continue with patient care as appropriate.
Very good.
Okay, Mr. Conner, you're all set. We're all done.
Great.
Thank you.
Thanks. It'll be just a minute while we get our gear off and then we'll clear out, okay?
Sure.
Thank you. Great job, Tamika.
Oh, thank you.
Well, now that the procedure is finished, we have to remember that it's just as important to follow a strict procedure for removing our protective gear as for when we put it on.
Right.
So what should we keep in mind as we proceed?
Well, as we remove our protective equipment, we need to make sure we proceed in a manner that prevents contact with any contaminants that are on the surface of the PPE.
Very good. So to start with, my waist strings are tied in the front of my gown, so I'll untie them before removing my gloves. However, since yours are tied in the back, you should remove your gloves before you untie them.
Got it.
And remember to follow the procedure we reviewed earlier for the proper removal of gloves. Okay, now if we were wearing masks and goggles, we'd take them off now. Since we're wearing face shields, they come off now. Okay, now how about our gowns?
I untie my neck strap, then pull one hand into the gown sleeve. I use the protected hand to pull the opposite sleeve down and off my other arm. I need to have no contact with the outside of my gown. Now I use the ungowned arm to grasp the gown from the inside and take off the other arm.
Disposal?
Turn the gown inside out and place in an appropriate receptacle.
Excellent.
Thanks so much for your patience, Mr. Connor.
Thank you.
Thank you. We'll see you again soon.
Bye now.
Take care. Great job, Tamika.
Thank you.
Okay, next scenario. You're assigned to care for a patient who has an antibiotic-resistant infection. You see another member of the healthcare team enter the room, and you realize they aren't wearing protective equipment. As she exits the room, you ask her about the appropriate transmission-based precautions.
Excuse me, shouldn't you be wearing protective equipment when caring for that patient?
Yeah, whatever. This guy's been here all week and nobody's been wearing that stuff.
You're uncertain about the infection's mode of transmission. What should you do? Should you be concerned about cross-contamination and disease spread?
Well, I always remember that I'm responsible for my own actions, and I should always take the time to ensure patient care isn't compromised.
Exactly. With that in mind, how would you go about addressing this issue?
I start by consulting the infection control manual and the institution's policies regarding specific illnesses. Then I'd review the mode of transmission associated with the particular microorganism so that I'm following the proper procedure.
Are there any other steps you could take?
Yeah, I'd go with you, Ms. Swenson, to talk to the nurse manager to make sure that the staff is also following proper precautions.
Very good. Excellent work today, all of you.